So, members, today we are aiming at looking at a few healthy tips uh, that we could consider in some of the issues. And meanwhile, let us share the link. Let us share to other people so that we can what? We can start straight away. So please, you share the live so that we can uh, start. So, members, today we are aiming at looking at a few healthy tips. Few healthy tips uh, that we could consider in some of the issues. And meanwhile, let us share the link. Let us share to other people so that we can what? We can start straight away. So please, you share the link so that we can start. Few healthy tips uh, that we could consider in okay. Some. So let me go straight to the issues I wanted to share with you today, which are including one, HIV, which is on rising as of today. We are registering very high cases of HIV. Reason being, people no longer understand, or people do not know how HIV is being transmitted. Most of them are believing in myth and they don't know the facts. And that's why HIV is spreading from person to person, which is causing. So I want to start with the myth that people use in HIV that are actually causing some of us to get HIV, yet we are not actually aware of these wrong myths. One, most of the people believe that HIV is transmitted through sex. This is very, very wrong. Most people believe that when you engage in sexual intercourse with someone, that's when you can what? When you can get HIV. That is not right. You can actually get HIV from other people without engaging in sex with them, without engaging in anal sex or even vaginal sex or even kissing or no nothing. However, those are the permanent, those are the largest numbers of recruiting these people into HIV. So those are so most of the people are getting HIV from, yes, are engaging in intimacy with those positive patients when they are not doing it the right way. For example, they do not take PEP after having intercourse. They do not take PEP before having the intercourse, yet they know they are going to engage with someone who is actually positive. Again, they do not protect themselves when they're in intercourse. They don't use condom. So that is how most people are getting into what? Into this trap. Again, those ones who are doing anal sex is becoming more vibrant and it is more easily spread through that way than a vaginal way. At the same time, most people are getting it through kissing, and you're going to ask me why. Most of the people nowadays, they have oral infections and oral sores, so they usually have uh, issues with their mouth. They can bleed, you know. So most of them, as they are kissing, they poor kissing, that is because that's not the real kissing. The real kissing are getting into what? So most of them share tongues. Again, those ones who are doing the tongue is this side, this one, the tongue is in this one, and stuff like that. That's why most people are actually having that problems. Yeah, in terms of sharing kisses, and then they're ending up not only getting the infections, which we talked about, like HPV, or like any staph infections in the mouth, gingivitis, they can bleed, you know. They are like, so most of them, as they are kissing in their mouth, you end up also getting the same problem. And even in decay is because tooth decay is causing this one problem. Let's say bacteria, you're also sharing the same bacteria. So we give you a few times, or we give you a few hours, we give you a few days or month, you also develop the same problem. Halitosis, people are smelling mouth, which we talked about, like or having bad breath. We really say that they usually have issues, or they usually have problems or bacterial infections within their oral cavity. And that's why we are saying, why shouldn't we be careful? Moreover, there is what we call oral and esophageal cancers. Now, these cancers, they get in the mouth and in the what? In the esophagus or the gullet, this one, you know. So these cancers that people are having, which are rampant, most of the people will believe that they are coming from oral kissing. Let's say you get HPV, which subjects you to getting this cancer. You understand? So it is very important to consider these factors when you are in a relationship or when you are trying to engage with someone. That's one. Two, most people believe that HIV kills. This is not also right. HIV does not kill. If at all you have handled it properly, HIV does not kill you, and it won't kill you. So it is very important also to consider that the fact that I have gotten the HIV, which I was not ready for, which someone gave me and I was actually not intended to, which my husband is maybe a prostitute, or my wife is a prostitute, and they have actually gotten this problem. Do not hang yourself. Do not take poison. Do not get depressed to the maximum. Do not get stigmatized. These things are simple. In one way or the other, you are also taking medicine. You are just having any other normal condition, like someone who was born with asthma, or someone who was born with diabetes, or someone who was born with HIV. So don't be traumatized to the extent of hanging yourself or ending your life. Sometimes it is better to reconsider that you can take the medicine and still live as longer as you were supposed to live, or even more, because of continuous checks and monitoring. So it is important to know that HIV does not kill. So that's the second myth. The first one was we get HIV through sex, which is wrong, and we say that we can get it from anybody as long as we have blood sharing, or we have connection between one's body and another one's body, irrespective of the skin. That's why I'm saying we can get it from some other places too. We are saying it doesn't kill. Start taking the medicine and there is no problem. Another point, people believe that some of them can get HIV from hospitals. This is quite common, but funny the way it sounds. Like, how can someone get HIV from themselves and inject it to a person? Or how can we keep HIV to prepare to give it to other people? That is very wrong. We shouldn't be believing in such what? In such propagandas, in such lies, and in such myths. So please, if you are to go and check, please go and check, and don't believe what people are telling you. Again, there could be maybe some people who could be not trained professionally, or they are not good in their hearts. So what do I recommend? I do recommend that when you go to the hospital to get checked, please mind about the doctor who's working on you, or the nurse, or anything. Why? You need to look at the syringes, someone is opening them, they are new. You need to look at the swabs, someone is opening them, they are new. Get to see these things, whether you're on HIV testing, whether you're in malaria or typhoid, treating, whether you're in what, as long as you have followed the protocol. Look at the things they are going to use on you and rule out, no, these things are safe for me, these things are sterilized, so that they cannot give you infections that you are not ready for. So let's keep checking out these things before we say that HIV is the most dangerous disease. 3, I'm going to talk about herbal medicine. Most people are coming out nowadays claiming that they do have the herbal medicine that they can use to treat HIV. Most people, by the way, very many people are coming out with different herbs, trying to smuggle funds from people. These people, I am going to call them smugglers because they smuggle during day. Like everyone is seeing when this is happening, the government is quiet, everyone is quiet. If this really happened in another country, I think people would care, people would mind, people would. But here, people don't care. People won't really care. Someone can come out, get their grass or something from the bush, come, burns it, and start selling it 1.2 million or something like it cures HIV, yet it does not. And this one subjects very many people to false hopes of having medication. And again, the problem of people not responding properly when issues need. For example, people will stop taking the medication, people will stop swallowing the medicine for HIV, claiming they have gotten the treatment. So that is also a myth. Please stop believing those people who the medication for HIV, more so these herbalists. So it is important to consider that when you have an issue to do with HIV, keep taking your medicine until the ministries or the announce that we really have a solution for HIV. Unless otherwise, that position would be better into your inner self. So, case for HIV and more other myths that are really believed in HIV. So, HIV is wide. It is wide. But what I can recommend for any other person outside there, I know most of you will be, it will be hard for you to abstain, but it won't be hard for you to have a condom. At least carry it in your pocket. You understand? So make sure that you have a condom on before you engage into sexual intercourse with anybody. And I want to remind you that anyone can get HIV through any way. Let me tell you something which is funny. If someone got HIV today, they go into what we call a window period. In this period, we are having rapid multiplication of the virus. We have rapid multiplication of the virus. That's why we say that in the first 3rd week, 4th week, that's where we have the early signs of HIV. The headaches, because the body is responding. The headaches, the small rashes, the loss of appetite. Maybe you start recognizing yourself as if you have nausea every time. Like you start seeing those signs. Why? Because your body is trying to fight against HIV. There is a lot of integration. It won't succeed, but it fights. So most of the times when we are telling you, or not, sure they are not cheating outside, and you check them before you started staying with them, that becomes safer for you. But if you know that the woman you are with or the woman you are going to engage with is actually not been with you, or maybe you have met in the bar, or maybe something like that, or the relationship is just new, you have never met, it is very important to consider yourself a very lucky person when you put on a condom. Why? Someone would have gotten the HIV last week and you cannot detect it at this time using those normal tests. You understand? Even there is some time where PCR cannot detect it, let's say 2 days, and you cannot know where a woman slept. So it is important for you to consider or to know that people are sick. Most of them are sick. So even if you miss out something, you will get it in another way. Don't chase something which might end up getting you problems. So that is also a factor to consider when we are talking about HIV, that a window period when it is rapidly multiplying, someone can transfer that or someone can give it to you before it surfaces in that person when we test them. So we can test it and miss it out because it is too early. But when you're engaging with that person, it is just laughing at you. Are we together, members? Meanwhile, drop your question in the comment section. Let me see it. So please write your questions in the comment section and I will respond. So about sex, about HIV, I want to end with HIV phobia. HIV phobia is becoming rampant and is too much outside here. In HIV phobia, you have phobia. Phobia is like fear of something. So when we talk about phobia in terms of light, someone has light phobia. When they see light, they get off, they collapse, they want to run away, so they get irritated. So at this moment in time, the HIV phobia, people really fear HIV to the extent that when you knock on them and they suspect that you have HIV and you have just knocked your body on them, they feel like you have given them the disease and they will go and check. And if they find out that they don't have, they will not trust the results. They will go to another hospital and check again. And if they give them the same negative results, they take some time, they believe, yeah, these are giving us the right results. But after some time, they will be like, wow, maybe these people made a mistake again. They will come back and do another. That's called HIV phobia. It can follow you up, it can disintegrate your relationship, it can, it can do a lot to you when we cannot subtract the issue of relationship problems. If you have HIV phobia, you're likely to have issues with your girlfriend or your boyfriend. Reason being, you are always in fear as if you did something. Either it's very, very suspicious that if someone develops this disease, they are actually, they have experienced some past which they think they got this HIV from. So that one is also a point to consider, that if you are found with HIV phobia, or if you see yourself always testing for this HIV phobia, you would better look into yourself and change. So if they tell you no, it becomes a no, and if they say a white, it becomes a white. So it is important to get it that way. It was our first of today, and I'm sure and I'm not seeing questions in the comment section. Can I see the questions, please, so I can answer one by one? So it is important, and it is of a good view that you get to know most of the times when these things happen to you. HIV could be dangerous, but there are some diseases which might be more dangerous. As of me, I know diabetes, I know cancer, and others more dangerous than what you think. So these questions I'm not seeing in the comment section. However, rising, as we would need to. We are just having very high cases of HIV questions, so I can reason being people no longer understand, or people do not know how HIV is being transmitted. Most of them are believing in myth. I know cancer and others more dangerous than what you think. So then these questions I'm not seeing in the comment section. However, rising, as we would need to him already. Yes, in very high cases of HIV questions, so reason being people no longer understand, or people do not know how HIV is being shown. Most of them response, I believe in things growing in your anal area or your anus. You see things coming out. I know cancer and others more dangerous than what you think. So they could show up with what you think, blood after defecating. Then these questions I'm not seeing. Let's go to rising as pain, irritation, itching, him already. Yes, in very high cases of HIV questions. So reason being people no longer understand, or people do not know how HIV is being shown. Most of them response, I believe in things growing in your anal area or your anus. You see things coming out. I know cancer and others more dangerous than what you think. So they could show up with what you think, blood after defecating. Then these questions I'm not seeing. So this is what I'm saying. When hemorrhoids are coming, it is a sign that you're applying a lot of pressure down there on your pelvic area, and others applying a lot of pressure can subject you to getting hemorrhoids. However, we say that there could be genetic issues. We say that there could then these questions have something to do with how this is what I'm saying. Handled your lifestyle, constipation, what that you applying a lot of pressure down to do with hemorrhoids. There it is on your pelvic, stressing the veins down there. So it is important to consider that when you relieve this pain and tension around the area where you have considered to be having a problem, applying a lot of pressure can be reversed. However, it might not be there, depending on the size, depending on the what, and something to do with how this is what I'm saying, handled your consideration. So when we are talking about hemorrhoids, the moment you realize that there's something which is coming out of you behind, something to do with itching, something to do with pain, something to do with your seeing blood on your poo-poo when you go to the toilet, or seeing mucus, those could be the signs that you're having what? That you're having this condition we are calling hemorrhoids or piles. This is not very hard to manage. And if you have not gotten it, do not attempt to get it. It is the best way we can always prevent it. Do not get these piles. Do not get these issues to do with poor health. You behave bad, you will eventually get this problem. Now, these hemorrhoids, I want to be specific and talk about the hemorrhoids that have gotten out. Remember, we have hemorrhoids, but we also have anal prolapse. So some people, they see anal prolapse and they think it is hemorrhoid. Please be careful. Do not attempt to get that you have the best way. Yet you have anal prolapse and you end up dying and get this piles. So what do you get these anal prolapse? Issues to do with poor health. You behave bad, say this is where eventually get this problem. And this thing which is where hemorrhoid is coming from, it also comes along with the specific. We call that, and talk about the hemorrhoids that have. It is important also to know that what I have is this, and what I have here is this. Be careful. So we are saying to get that you have the best way. You can always prevent it. You end up do not dying and get hemorrhoids. My mother might these issues to do with poor health. Don't you have bad? This is where eventually get this problem. And don't you refuse to eat where you fiber from? It also comes with vitamin C, foods that will allow the hemorrhoid. So it is important also to know that what I have is this. Haven't you refused to do exercises? So it's be careful. So we are saying to get that which one special the best way you can always prevent it. End up do not strain the face around. My mother these issues to do with don't you have expect don't you have bad what I know eventually get always done. Don't you refuse to make fiber it also comes with vitamin C, foods that will allow the hemorrhoid. So it is important also to know what I have is this. Haven't you refused to get exercise? So it's be careful. So we are saying which one special the best way you can apply it. End up do not strain the face around. My mother issues in the water who are bad for some, don't you have bad what I know eventually, and in a day you can don't you refuse you have made where the fibers are also comes with vitamin C, foods that allow the hemorrhoid. It is important also to know what I have is this. Haven't you refused to get the exercise? So it's because so we are saying which one special the best way you can apply it. Do not strain the face around. My mother issues who are bad for some, don't you have bad what I know eventually, and in a day you can don't you refuse you have made where the fibers also comes with vitamin C, foods that allow the hemorrhoid. It is important also to know what I have the best way you can apply that and do not strain the vessel. So it is not meant that you are bad for some, what I know where you are, and in a return, if you are not using it, you are saying revival is an also comes however, I don't know who does that allow of the two. So it is important also when you make somebody you can apply that and do not change the so make sure that you are bad and in a return, if you are not using it, you are revival also comes however, I don't know who does that allow so as of today too. So it is important also when you make somebody you can apply that and do not change and in a return, if you are not using it, you are revival also comes however, I don't know who does that so as of today too. So it is important also when you make somebody you can apply that and do not change and in a return, if you are not using it, you are revival also comes however, I don't know who does that so as of today too. So it is important also when you make somebody you can apply that and do not change and in a return, if you are not using it, you are revival also comes however, I don't know who does that so as of today too. So it is important also when you make somebody you can apply that and do not change